Hello, friends. Dr. David Katz, another COVID reality check. These are getting to be few and far between for a number of fairly obvious reasons. In the parts of the world where this is most likely to be watched, the pandemic is winding down, or so it seems. And I think at this point, fewer of you are likely to be seeking answers. I think we've settled into a perspective that we call our own, and maybe they're not fully resolved, but I judge from the commentary that fewer people are seeking guidance at this point, and more are looking at things like this video to decide, does this person get it? Do they agree with what I know to be true? There's a fair amount of that. And I'm not all that interested in that. I'm not particularly keen to win a popularity contest. If you're settled in your view and you're comfortable with it, so be it. You may not be interested in me attempting to change your mind. If you happen to agree with me, then I'm not telling you something you don't already know and believe, and I'm not much help. And my mission is to be helpful. So I really wanted to populate a void. I wanted to offer commentary at a time when I thought perspective would provide comfort. And I think largely that time has passed, but not completely, and so here I am. And I can't say for sure that this will be the last of these, but it might. The first thing, and by the way, this issue of being settled in our points of view, I would caution against that. The history of this pandemic will not be clearly unpacked until we're looking back at it from the perspective of some distance and the clarity of hindsight. A lot of what we think we know will prove to be incorrect. It's still a moving target. I feel quite confident about some of my early convictions, but it's also clear that every time someone propounds an opinion or a perspective about the pandemic that gets any traction, people react to that point of view and potentially change their behavior, and then that change in behavior alters the trajectory of the pandemic. So, essentially our predictions create the future, for good or for ill, either moving people in the direction we might hope, or potentially away from it. So, saying things to provide comfort, for example, things are looking better, might induce a large number of people to be less careful, which then turns things to the worse, right? So, sometimes the law of unintended consequences kicks in even as we're trying to provide clarity, comfort, and guidance. So, again, we'll be looking back at this from some distance before we really know what's what. But a couple of things are crucial right now. The first of which is that pandemics are global. It's intrinsic in the term. An epidemic is an outbreak at some scale that doesn't span multiple countries or the world. A pandemic is everywhere at once. It is intrinsically global, but we're getting a vivid illustration of that in the massive discrepancies now in the status of the pandemic in different parts of the world. Here in the United States, we're rapidly moving toward the end of the tunnel, or so it seems. But of course, the current situation in India is calamitous. I would argue that if we accept that a pandemic is global, none of us is out of this until all of us are out of this, for two reasons. The first was nicely encapsulated by John Donne. If I may paraphrase, no person is an island. Any person's death diminishes me because I am involved with humankind. Donne's version was a little more sexist, but same gist, right? So substitute human or person for man in Donne's version. That's the gist. We are all caught up with one another, one great big extended human family. We're not through this anywhere until we're through this everywhere. And I hope you all share that perspective. It's fairly intimate for me. My business partner at Diet ID is an Indian American. Her extended family is in India. They're suffering losses weekly, and I feel those acutely. And the one thing I can do, other than lament that, is share a link that she provided me of what we think is one of the better charities, one of the better means of extending our support to that part of the world, along with heartfelt condolences for any of you experiencing losses. Terrible situation there. But the other reason, if we're a little less altruistic and a little more parochial and selfish for us to acknowledge that pandemics are global, is that right now there is circulation in India of a triple variant, a triple mutant strain of the virus, B1167. As I record this, the World Health Organization has just announced that this is a strain of concern, meaning that this newly developed triple mutant strain of SARS-CoV-2 may pose risk to populations that were exiting the pandemic. It clearly poses a risk in India, that's not in question, but it may pose a global threat, and that's what WHO is announcing. And consequently, again, none of us is reliably out of this until we are all out of this. And that doesn't mean that SARS-CoV-2 is eradicated. That doesn't mean the risk of transmission or exposure is zero. It means that this has receded into the background noise of epidemiology, where our risk was never zero on any given day of getting an infectious, serious, or otherwise. Living involves risk. We are not going to a risk-free world in the aftermath of the pandemic, and the risk of exposure to SARS-CoV-2 will configure itself among the various risks we faced before, but it's not yet there, obviously, when it is roiling epidemiology at an unprecedented level in places like India. But that strain is concerning, not because B1167 appears to be resistant to the vaccines, but it's already a triple mutant strain. And as that spreads, and keep in mind the population of India is over 1 billion people, and as I've espoused in prior videos, everybody who gets infected with this virus has 1 billion copies of the virus in them, give or take. If 1 billion people have 1 billion viral copies, that's a quintillion viral particles, and we're just talking about the population of India, to say nothing of the rest of the world. Well, if the B1167 strain is the prevailing strain, an awful lot of those quintillion viral copies become that triple mutant. That's the new baseline. Now that triple mutant strain can mutate yet again and generate new strains that are variants on that new version of SARS-CoV-2. Now we're talking about quadruple mutants and quintuple mutants, and you get the idea how many of those steps need to occur before, in fact, the virus is different enough that vaccination no longer is effective and all the gains we've made toward herd immunity go away. Time was never our friend. And by the way, I will double down on my early position. Total harm minimization clearly was the right priority for all of our policies. We'll come back to that in a second. But so was a risk-stratified approach to the virus, allowing exposure to occur early on. Because if a high percentage of low-risk people had been exposed around the world early, we would have been 2/3 of the way toward herd immunity, with a massive reduction in the casualty toll because the most vulnerable would have been protected, and that would have shortened the timeline. And we're seeing now the perils of a long pandemic timeline. It gives new strains not only time to develop, but time to spread. And it's the spread of new strains that allows for mutation on top of mutation on top of mutation. We are not out of these woods until our brethren in India and around the world are out of these woods. Pandemics are global. Help out in India if you can. If you weren't a humanist before, if you didn't subscribe to John Donne's view of the world, I think now is a vivid illustration of the reasons why the world is small. We're all one extended family. It's a great time to sign up for the tribe of humanism. I've long declared that to be my tribe. I double down now. But again, I'm heartbroken about what's happening in India. But don't think you are safely out of the woods in this part of the world until the situation in India or in South America is resolved. And again, this is a simple case of evolution by natural selection in fast forward. That's what's going on with these viruses. Any doubts about evolutionary biology, just look what's happening with the virus. It is adapting, and the strains that are better at spreading will spread. They'll become the new standard, and then they become a new baseline that can mutate again. Again, we want to put a stop to that. The other thing that I want to address today is this recent report. It's gotten a fair amount of attention by the Institute for Health Metrics and Evaluation, looking at the total global mortality toll of COVID-19. The first important message in this paper, and I'll attach links, of course, is that the mortality of the virus is higher than reported because in many parts of the world, the epidemiologic wherewithal to capture mortality in a cause-specific manner is quite limited. So in fact, it's a number of small and less industrialized countries where there's the greatest underreporting of COVID-related mortality, which actually produces an interesting shift in the global perspective on this, because the countries with the highest mortality toll per 100,000 population are not the ones that top the list at Worldometer, for example, which is only dealing with reported deaths. And of note, I do think this is significant. Sweden's mortality toll doesn't show up anywhere near the top in this corrected model. It's very interesting. And then the other thing about this report that I find really quite compelling is that there have been major shifts in indirect causes of mortality related to the pandemic, which is what some of us were fussing about at the beginning. That there was more than one way for a COVID pandemic to harm us. One way is the virus could infect us and cause serious consequences. But the other was our policies could cause serious consequences, harm people, and potentially lead to death by many mechanistic pathways, delays in care for other conditions, addiction, alcohol, depression, and so forth. And all of that is captured in this report. And indeed, there were apparent shifts in all of those causes of mortality, indirect consequences of the pandemic. From my point of view, it is a reaffirmation of the importance of total harm minimization as the right perspective, not just for this pandemic, but any pandemic. We really ought to be looking both ways before crossing our next public health crisis. What are the direct ways this can harm people? What are the indirect ways our responses to this crisis can harm people? How do we minimize the total? Who's at more risk for which? That's where my commentary on the pandemic began, and I stand by that perspective. And again, because of the dangers in the extended timeline, I feel quite strongly that a risk-stratified exposure makes sense. And I say that as someone who was infected with this virus, so I'm through a COVID infection, as many of you know, and have suffered long COVID symptoms, mild, because of my baseline health. I would never have been in the lowest risk group just because of my age. At 58, I'd be in an intermediate risk group at best, no matter my health. It was always clear that people under 50, and in particular people under 40 or 30, were in the very low risk group. But because of my health, I would expect to be in a fairly low risk group, and indeed I am. And I had a mild infection, and my long COVID symptoms, now that I'm 3.5 months out, are mostly over, and my olfaction is mostly back. All of this is consistent with what we thought we knew. But the case of long COVID is still developing. We're still in the process of learning, how long do these symptoms go on? How serious are they? What percentage of people who've had this infection are subject to them? How does long COVID vary by age and prior health status? Is it in fact varying with some other factor like genetic markers or immune system status that we don't routinely measure? All of that is a story yet to be written. And any risk stratification we had done early in the pandemic would have been relatively blind to that. And that's the danger in it. But let's face it, when you're in a pandemic, you have no risk-free choices. Your job is to try to minimize total harms with the information you have. So total harm minimization by means of risk-stratified or vertical interdiction, that's what I wrote about in the New York Times all those months ago, still makes perfect sense to me. And the thing that makes even more sense to me now, this is emerging in a vast number of publications that increases by the week, is the tremendous liabilities of poor cardiometabolic health that much of the modern world brought with them into the pandemic, and that we are continuing to ignore. I'm still hearing almost nothing in the United States about let's focus on getting healthy. We have a massive burden of obesity, diabetes, heart disease. These are all huge liabilities anyway, and oh, by the way, huge acute risks related to COVID outcomes. And since we're not completely through this yet, and we're worried about new strains, and perfect time for us all to engage in collective health promotion efforts. I'm hearing far too little about that. We were mired in a pandemic of chronic cardiometabolic disease before ever SARS-CoV-2 found us, and the toll of this pandemic was monumentally worse than it needed to be because of the prior pandemic we ignored. And even before I weighed in about total harm minimization and risk-stratified interdiction, I weighed in about the fact that there was a bigger pandemic than SARS-CoV-2 happening in slow motion, year in, year out, hiding in plain sight, about which we were complacent, if not contemptuous, and that we would reap the whirlwind, and we've been doing just that. So my hope persists that among the lessons of this pandemic for all of us will be that the chronic state of our health is potentially an acute liability when something new like SARS-CoV-2 comes along, and that chronic vitality is the best acute defense. So that's my current take, and as ever I will attach links that address some of this, in particular the opportunity to support ongoing efforts in India. Anything else I think is directly relevant, the IHME report on mortality, which is very interesting. And I hope the commentary here is a fruitful discussion. Trying to think if there's anything else I should address. Oh, I will, one final thing actually. Obviously the issue of immunization remains contentious in our society. I am a proponent. I have always been a proponent. Some of the comments seem to suggest that my opinion there has changed. Never changed. I never thought we should hunker in our bunkers and wait for a vaccine without knowing when a vaccine would come. I thought the liabilities of that were too great, and I thought it would forestall progress toward herd immunity in the safest way possible. And again, I stand by that. However, having had COVID, developed antibodies, I nonetheless have had 2 doses of the Moderna vaccine. I'm now fully immunized. I had minimal reaction to either dose of the vaccine. I was actually surprised. I thought I'd feel crummy for at least a couple of days. And, I think my immunity is optimized at this point. Basically, I had 2 boosters since I already had antibodies from the infection. And I was quite confident, based on the surveillance of vaccine administration, that this would both enhance my immunity and do it in a relatively safe manner. I did not think the risk associated with immunization was 0, because the risk associated with almost any action we take is more than 0. But I thought it was vanishingly low and did not concern me. And so I've been immunized. My family's all been vaccinated. And I also value the convenience factor. My wife is French. We have family in Europe. We want to be able to travel, see family again. And that's going to be easier, frankly, when you can demonstrate that you've been immunized, and that convenience factor is non-trivial. We're fortunate in this part of the world that we have access to the vaccine. So I've taken advantage of that. I practice what I preach with regard to everything: diet, exercise. I try to do it with sleep and stress. I certainly do it with regard to vaccines. And also just to note, there were some comments about the pause in the J&J vaccine. Personally, as a public health expert, I think that was handled perfectly. We thought there were 6 cases of these strange blood clots and low platelet counts out of about 7 million doses, but we didn't know for sure. If 6 came to our attention, were there 600, were there 6,000? There was a certain number there where that vaccine would prove to be unacceptable. So the right thing to do was pause, do active surveillance to see, are there cases we've yet to identify, how big a threat is this, and in addition, ideally, can we identify people who are at risk of this vaccine complication so they can be diverted to a different vaccine. And then after a quick pause and the time required to do that reconnaissance, the conclusion was just right, that the vaccine was very low risk, that in fact there weren't a lot of, at that point, undisclosed cases of this complication. It was indeed rare. The risk of the vaccine was vastly less than the risk of getting COVID. And I think the work still goes on to determine who may be at increased risk of complications of the J&J vaccine. Obviously, the production of the J&J vaccine has other issues related to that plant in Baltimore, but that's another story. But to be clear, I think that's just the right thing for science to do. When you're uncertain about the magnitude of risk, you pause and assess. And sure, there's a downside to that too. People who might have been vaccinated in that span of several days had to wait potentially, and there's some risk associated with that. Again, the only way to avoid pandemic risk completely is not to be in a pandemic. Once you're in a pandemic, all of your choices are a little bit fraught. I thought that was just right. Science is fallible. Scientists know that science is fallible. Good scientists are always doing our best to advance public health, but are always willing to admit that something may have gone awry and to reassess. And I think the way the J&J vaccine was handled was just right from a public health perspective. Okay, that's really all I've got. I'll attach relevant links. Please help out in India if you can. If you are being affected by pandemic turmoil in parts of the world, I'm with you. I'm sorry. I hope we'll get through this, and I think we'll get through it better if we all stand together. In unity, there is strength. We are one extended human family. And with that, I wish you and your family well. Stay well, and until next time.